Just to bring this to everybody's attention, we'll be recording this session. It serves as documentation for us because we will have similar such webinars with other practitioners as well. So we want to keep this information with us. So we'll be recording. And if we use it in any sort of social forums, if you don't want your face to be seen, so you can always ask us to blur it and we'll blur it. Yeah, maybe we can even start properly. Would anybody like to uh, switch on their video and introduce themselves here in the community? Hello, Giridhar. Giridhar just joined. Since we, Hi Akshata, good morning. I'm just checking in now. Is everybody comfortable with English, or also um, should we communicate in Hindi, or I don't know? Is everybody comfortable with English as a language? If you can just drop in the chat saying yes or no.
Yes, ma'am. I'm comfortable with English.
Okay, all right. Thank you, Hari. Okay. Vinata says yes. Okay. Veena says yes. Okay. Amulya says yes. Hello, Sandeep. Triveni says yes. Okay, perfect. And we want to keep this session as interactive as possible because the more interactive it is, the more we feel a safety and connection with one another, and more sort of will be easily be able to ask questions. So just treat this as, as a safe community where you can sort of just come in, ask questions, and preferably the questions would be at the end, which is the last 15 to 20 minutes of the webinar. Just a second, somebody wants to join. Yeah, preferably it will be the last 15 to 20 minutes, and so you can keep your questions there, and in the middle, if certain questions come to you, you can always drop it in the chat box. Yeah, so the duration of the, so we will stop at 12. We will actually ideally stop at 11:40ish, I think. And after that, your questions will be there. So we would love to answer as many questions as possible. And if not, there is always the community that where you can ask your questions, leave us a voice note, and we will try and reply to each one of your questions, even if it's later. Does that make sense? I am I'm going to be one such host that's going to keep asking for responses, so please bear with me. All right. Okay. Should we start, Dr. Anurag?
Yes, Rick.
Okay, all right, okay, perfect. So I am just introducing myself, I am Anuksha. I've been a psychotherapist, a therapist, psychologist for the last 15 years, and we have this community called Heal Care, which is more an integrative health platform which introduces people, audiences to verified practitioners all across the country, and mostly practitioners who believe in integrative healthcare, who believe in holistic healthcare. So we have psychologists, psychiatrists, we have nutritional therapists, as well as functional food medicine doctors such as Dr. Anurag. We have top physiotherapists, we have Ayurveda doctors, homeopaths, naturopaths, yoga therapists, etc. So the list is sort of it's a consciously curated list, and we believe that healing happens when we take the whole person in perspective, which is we address concern about the mind, body, lifestyle, emotional health. And in today's webinar also we would be highlighting those factors as well. I mean, of course, Dr. Anurag knows the best, but we will be hosting more such webinars, one-on-one webinars with Dr. Anurag himself, and also many other esteemed practitioners such as himself, where we will be where we'll be talking about similar such lifestyle conditions, and how to recover from those conditions holistically, right? So I will share the link of Heal Care here, the website Heal Care, and then you can understand, you can go through the website yourself. So with us today, today we have today's webinar is from resistance to resilience, so which is healing the root cause of diabetes through lifestyle and functional medicine. And with us here today we have Dr. Anurag S Kumar, who's a physician who's deeply committed to this cause, who's committed to lifestyle and root cause healing, and he has invested years of research, his clinical research, and his transformative work has been around diabetes remission, where he explores how targeted dietary changes, nervous system regulation, and lifestyle interventions can actually reverse metabolic dysfunction in the human body. So his work reflects a compassionate and evidence-based approach to chronic diseases, which is designed to empower individuals such as yourself. And today's webinars will be looked from the lens of functional medicine. He'll be looking at functional medicine and diabetes, and how insulin resistance develop, how modern stress physiology actually fuel such metabolic issues in the body, and most importantly how to bring about certain powerful lifestyle changes which can turn the body towards a path of recovery and healing. And yeah, so I think this is going to be the long and short of what the webinar is going to be. Of course, he will bring in his skills and expertise here, and we would be happy to host all your questions, hear all your questions at the end. If you have any questions, just sort of post it in the chat. All right, over to you, Dr. Anurag.
Thank you, Anuksha, for this beautiful introduction. So let's start today's session. Myself, Dr. Anurag. I'm lifestyle and functional medicine physician specialized in diabetes. I'm also certified in lifestyle and functional medicine. So as Anuksha told, let's keep this session interactive. Let's speak. Let's practice things. Okay. Then we can have better takeaway once we end this session. So to start with, this session is for people who are suffering with diabetes, who have family members with diabetes, those who are having early signs of insulin resistance, and those who want to identify what is insulin resistance and how we can prevent diabetes in your upcoming days. Okay, so if possible, can you just switch on your video so we'll have some short exercise in between, because WHO has told sitting is a new smoking. So we should break that habit of prolonged sitting some with some bodily movements and some physical activities. Whoever can, they can just switch on their video so that we can just practice some activities to activate yourself, because it's Sunday morning. I think few of them has had their breakfast and they are in their snooze mode to take some rest and take some nap. So just activate ourselves. Okay. So this is the exercise which we should do breathing with your hand movements. Okay. So I will just teach you what to do. You can just practice and follow my instructions and do this activity. Okay. So just type yes if you are excited and to start with this activity. Let's keep the session interactive so that I'll also get some motivation to tell more things and have a session in a better way. Yes. Thank you, Hari. Yes. Got it. So let's start with this exercise. Let's just keep our hand with the fingers locked in front of your chest. And what we can do is inhale and you should put your hands out, and exhale and bring your hands in. Okay. So we will repeat it 5 times. Inhale with hands out, exhale and bring it in. Inhale, hands out, exhale and bring it in. Inhale, hands out, exhale and bring it in. You can also next do it in front of your forehead. Okay. Not above your head, but front of your forehead. Okay. Inhale, hands out, exhale, bring it in. Inhale, hands out, exhale and bring it in. Inhale, hands out, exhale and bring it in. Now above your head, overhead rise. Okay. Just inhale with hands over your head, exhale and bring it down. Inhale, overhead rise, exhale and bring it down. Inhale, overhead rise, exhale and bring it down. Okay. So this is the practice which you can do it regularly between your work and once you wake up in the morning to activate different metabolism in your body. Okay. So now we will do 5 chair sit-ups. Okay. You should just get up from your chair and sit back. So that will also activate various metabolic pathways and help to have that blood circulation and help to manage your blood sugar in better way. Okay. So let's do just 5 chair sit-ups. 1, sit back. 2, 3, 4, 5. Yes. Thank you for your active participation. So I think it activated our brain in a better way. So now we will just jump into the session. As I told, whenever I ask any questions, you just type it in the chat box, your answer, so that I'll get to know what is your response and how I can move ahead with it. So Anuksha, just let me know once my screen is presenting.
Yes, it goes.
It's visible, huh?
Yeah, it's visible. For the yeah. Is it visible for everybody? If it is not, then you can always spin.
Yeah, it is visible.
It is visible. Okay,
Okay,
perfect.
okay. Thank
Thank
you.
you. Thank you.
So let's start the session. As Anuksha mentioned, it is trying to find the root cause of insulin resistance, that is silent shift which is happening in our body. So this is brief introduction about myself. As I told, I am a allopathic doctor with certification in lifestyle and functional medicine. So in this session, we initially try to find what is the root cause of diabetes and insulin resistance. And with simple science, we try to understand what is insulin resistance and how it is affecting our body. And let us see what are the early lab parameters and tests we can do to identify the insulin resistance in early stage. And even for diabetic people, why these parameters are important. Next comes different pillars of lifestyle medicine. That's serves as root cause for all these conditions, and how we can concentrate on each of these pillars to get better results in managing the diabetes and insulin resistance. Next, which is very crucial and important, psychosomatic aspect. How our stress and mind-body connection have impact on your diabetes, and how we can manage it in a better way. Because you might have heard people or practitioner telling the importance of diet, exercise, physical activity in managing diabetes and insulin resistance, right? But along with these things, it is very crucial to understand how your emotional health have impact on your physiological health and how it can have impact on your diabetes. That is one of the important section. Don't miss that. And finally, we can have reflection on your key takeaways, and then we can have Q&A. So to start with, understanding the real root cause of the diabetes. Every World Diabetes Day, we talk about sugar, but sugar is just a manifestation. It's an end result. But how it causes? What is the reason for increased blood sugar? The answer is insulin resistance. Type 2 diabetes is not just a sugar disease, it's insulin signaling disorder. Okay. Insulin resistance begins silently years before it manifests as diabetes or high blood sugar. So if your person is diagnosed with diabetes now, this insulin resistance has started 5 years before or 10 years before and silently affecting that individual. Okay. And there are also other manifestation of insulin resistance. It's not just diabetes. It's manifested as fatty liver. It affects in fat accumulation in your liver. And PCOS, one of the significant cause in most of the women nowadays. And insulin resistance is also root cause for PCOS. And insulin resistance is also reason for high blood pressure, hypertension, and it is also manifest as heart disease. So you don't consider insulin resistance as diabetes, and that's the only reason for diabetes. So there are many things that insulin resistance can manifest as. So we should be very careful in identifying this insulin resistance and addressing it in a right way. So this, you can just visualize this tree. You can see there is a root which has deeply embedded in the soil. So, and there are trees and leaf and branch which is visible for the external world. So if you can visualize, this leaves and branches are the symptoms. For example, high blood sugar which you are having. We'll try to figure out what are the roots which are causing for this high blood sugar, okay, diabetes. So this is the basic model. It's a bit technical, but I try to explain it in simpler way, try to understand it, and we can have questions at the end of the session if you have any queries. So this cell, you can consider it as a lock and insulin is a key, okay? So you need this key to open this lock for blood sugar to enter into these cells. It's a just simple fund of lock and key where insulin will open the key for blood sugar to enter into the cells. Okay. So keep this in your mind, keep this picture in your mind so that it will be easy for us to understand things in upcoming slides. So insulin acts like a key. It helps the sugar to enter into the cell where it is used for various energy in our body. When insulin doesn't work well, the sugars stay in the blood and start causing problem. It manifests as different things like weight gain, tiredness, and finally manifests as diabetes. So the main reason for diabetes is the insulin which is produced in your body is not rightly utilized by your cell for blood sugar to enter into the cells. Okay. This is the basic mechanism. So just type S if you understood this concept. So because this is very important and crucial to understand things in your upcoming slides. So this is the basic concept of insulin resistance everyone need to know and understand before we move ahead. So next we have science behind insulin resistance. As I told, insulin acts like a key. And what are the causes or factors that will cause insulin resistance? What will make this key not accessible for lock to open the lock? Okay. So it might be various factors. It starts from your stress, poor dietary habit, low physical activity that will lock the jam. Okay. So you can't insert this key inside the lock. Because of all these factors, there'll be jam. When there is a jam, you can't open the key, right? So all these factors will hamper the key and it will not cause that key to open the lock. Okay. The body release, once it is not happening, body try to release more and more insulin. You can correlate with the unserviced bike. As your unserviced bike will consume more and more fuel to give this efficiency and to run, right? So once your body can't utilize the insulin which is produced in your body, it will try to produce more insulin. But the end result is your body is not having that efficiency to utilize that. Similar to unserviced bike. If you are keep on using unserviced bike for longer time, it will consume more fuel. But the end result is it will end up with low mileage, right? So this is the same mechanism which is applicable for our body and for insulin and insulin resistance. Clear with your concept of insulin resistance? Just give thumbs up and type yes. If you have any questions with insulin resistance, just type in a chat box. We can address it at the end. So before that, I just want to ask few questions. How many of you feel sleepy post-meal? Just type yes if you are feeling that. How many of you feel sleepy post-meal? Just type yes in the chat box. Okay. I can see some responses. How many have high belly fat and finding it difficult to lose your belly fat? Just type yes in the chat box. So how many of them feel difficulty in losing your weight? Just type yes. Okay. Above all these things, how many of you experience brain fog and mood swings in your day-to-day life? Yes. I can see yes for most of this from most of your people. If you look at what is the cause for it, these are the early signs of insulin resistance and also progress signs of insulin resistance. So signs you can notice like feeling sleepy after meal, craving for sugar or caffeine, increase in belly fat and difficulty to lose that, dark skin patches which is around your neck, and skin tags which you can see in your neck region and throughout your body. That is also sign of insulin resistance. And people with brain fog and mood swings and difficulty in losing weight. All these things are the signs of insulin resistance. If you have this, don't just neglect or avoid this thinking that, yeah, it's a daily routine. This might be the reason because I had high carb meal or something like that. Just get your assessment done and find it and try to assess your insulin resistance. So now we have few parameters how we can assess insulin resistance. Most of the people think that assessing the blood sugar and HbA1c are the parameter to know your blood sugar. And even most of them are not even bothered to check their blood sugar with all these symptoms. It's very crucial to get your assessment done. Along with blood sugar and HbA1c, there are few other parameters that you need to check to know your insulin resistance, like 5 to 10 years before you develop diabetes. So few of them are fasting insulin, because as I told, once your body can't utilize the insulin which is produced in your body, it starts secreting more and more insulin. So the first stage in insulin resistance is overproduction of insulin. Okay. So if the insulin in your body is more than 8 microgram per ml, that is the early sign of insulin resistance. If it is less than 8, that tells that your body is adequately utilizing the insulin in a better way. Your vehicle is serviced well, and it is giving better efficiency. Okay. But if the insulin is more, it is the early sign of insulin resistance. Next, there is one parameter called as HOMA-IR. It is also early parameter to assess your insulin resistance. It is calculated value using your fasting blood glucose level and fasting insulin. You will get in certain labs. Okay. And next one is triglyceride to HDL ratio. Triglyceride is a cholesterol parameter and HDL is a good cholesterol. Okay. And once the triglyceride is high, that is also earliest signs of insulin resistance. Okay. Because once your body keeps on producing insulin, insulin is an anabolic hormone, means it will start accumulating fat in your body. So first sign of it is it produces more cholesterol, especially triglyceride. Okay. So if your triglyceride is high, that is also earliest signs of insulin resistance. Okay. And there is something called as waist to height ratio. You should measure your waist circumference and you should measure your height. And there are certain values to check your waist to height ratio. If it is more than certain value, that suggests you of insulin resistance. If it is difficult for you to assess your waist to height ratio, just check your belly fat. Okay. If your belly fat is more, if you are having that central obesity, this is also earliest signs of insulin resistance. Don't neglect that. Okay. Because most of the Indians are, we call it as tofi. Okay. Thin outside, fat inside, especially Indian male. We look fit from outside, but we have that silent visceral fat. So be very careful about central obesity and visceral fat. If you are having the visceral fat, it is also one of the earliest signs of insulin resistance. Okay. So no need to go for any labs. You can just look into your tummy and you can assess whether you have insulin resistance or not. And we have advanced parameters like CGM patch is called as continuous glucose monitoring patch. In that, we will get to know almost 96 reading per day of your blood sugar. And this is also one of the important parameter to check the insulin resistance and early signs of blood glucose level. Along with that, as I told, fatigue, constant hunger, poor stress tolerance. Okay. There might be disturbed sleep and menstrual irregularities in women because of PCOS. All these can be considered as earliest signs of insulin resistance. So, as I told initially, this is functional medicine tree where you can see in the branches and leaves of the tree various disease and various conditions. But if you look at root, what is the root cause for this insulin resistance to happen? That lies in our lifestyle factors. These are called as pillars of lifestyle medicine that we will see in our upcoming slides. That is your sleep and your stress, exercise and physical activity, nutrition, stress, social connectedness and positive psychology along with your relationship. Other than that, there is one more factor, which is alcohol and smoking, habits that you have in your day-to-day life. All these are roots of your tree. Okay. So next we will see what are the each tree, what are the root of this tree, and how we can address these things. So these are 6 pillars of lifestyle medicine. It's not just one pillar or diet. So improving insulin resistance means taking care of your food, movement, sleep, and stress. So nutrition, as most of you know, nutrition is very crucial and food is the first thing that you need to prioritize. You should consider it as your food as your medicine. If you don't want to pop up like your pills like a pills like a food. Okay. So just consider your food as a medicine and have mindful eating so that you will not pop up pills like a food. Okay. So eat real and unprocessed food. Prioritize fiber and protein and healthy fats. Okay. Eat with sunlight and not screen light. Okay, most of us have this habit to watch TV, to watch mobile, and to have this like scrolling social media while we eat. This is very crucial. Even though you eat right food, if you are not having that mindful eating, that will have a lot of impact on your health and well-being, mainly insulin resistance. So make sure you are eating right food and in right way. Okay. So and you should have it at least 3 hours before you go to bed, as our ancestors practices. Like they used to eat only when the sun is up, so they used to stop eating like after sunset, because your digestion is maximum when sun is up, and your digestion capacity gradually deteriorate as the night progress. Okay. So try to have your meal as early as possible. That is one of the crucial thing. Okay. So rather than thinking about calories, you think about different colors. Try to have rainbow colors in your food. You can see that real plate, right? It is filled with colors. It has beetroot in it, it has chana in it, it has some greens in it, it has dal in it. Okay. So try to have rainbow colors in your food. It is very crucial. Okay. So there are recent publications and recent news which tells that changing eating habit is fueling obesity and diabetes, especially Indian diet. Okay. And there is also articles which tells that why carbohydrate dependence is pushing us to diabetes. Okay. So I just want to ask question for all of you. Do you think carb as your enemy? Carb means rice, wheat, millets, ragi, jowar, bajra, whatever you eat. Do you consider carb as your enemy for diabetes or other health? Just type yes if it is yes, or no if it is no. Just I want to know your opinion in the chat box. Is carb a real enemy for you? Yes, just type your answer so that I want to know what is your understanding so that I can address in a better way. Okay, so my answer is carb is not your enemy if you have it in right portion, right time, and have it with right food combination. Okay, so for initial few days, for the person who is extremely diabetes, we might ask them to stop carbs for few days, few weeks, but you can't sustain throughout your life avoiding carbs, right? Because that is a staple food. We are born with rice, chapati, and various foods in our day-to-day life. I can't ask you to stop having rice throughout your life, because in India, food is a celebration. If I tell you to stop having certain things, there most of us will not feel any purpose in our life. So we can't consider carb as your enemy, but as I told, it should be in right portion with right combination and right time to have it. Okay. And as I told, there are certain exceptions. When we start having diabetic management program, we can ask them to have grain-free meal or avoid carbs, just to give that rest to your body and that recovery to happen. But that is not a permanent thing. So all these things should be done under the supervision of the practitioner, so that you are aware when to have what and how long you should restrict and when to restart it. Okay. So these are the real plates which you can see. This is just simple Indian meal. It doesn't have any specialities in it. You can see different veggies and different subsies that you do it in your day-to-day life. It has, but the key thing is it has all the components, and it's a mixture of all the components. It has fiber in it through veggies, and it has protein through it. It is from different dals, different chana, rajma, and one of the plate also has egg burji in it. So it is very crucial to have all three components in your meal. Okay. And one thumb rule is where everyone should aware of, the order of eating is very crucial and very significant. Even though you have the same meal, if you just change the order, that will cause significant improvement with your blood sugar level. So recently, I saw most of the celebrities also put up these points. They are eating healthy, they are eating right food. Then also they see that spike in the blood sugar level. And I also see significantly in most of my clients who are on CGM, just changing this meal patterns have changed their spike in the blood sugar in significant amount. Okay. So start with fibers, start with veggies, then go for protein source, then you can have your carbohydrate. Make sure you have this. You can take screenshot of it. Okay. Keep it in your wallpaper and make sure you practice it at each and every meal. Order of eating is very crucial and significant. So next comes physical activity. As we all know, physical activity is very crucial to manage your blood sugar. Okay. So most of us have time issues and time constraints to have regular physical activity or regular exercise. That's why I want to teach you one evidence-based proven technique that you can practice at home, that is easy to follow and that has significant result on your blood sugar level. And there are also research papers which tells that what is the importance of this movement that you have it in your day-to-day life. This is nothing but it's called as solius push-ups, which is calf rise. Okay. So while sitting, you just need to lift your heels while you're keeping your foot toes on the ground. Okay. That will activate calf muscle, which is called as peripheral heart. Okay. That will help to pump your blood back into your heart. Okay. And it will also act on various metabolic pathways to utilize the blood sugar which is there in your body. So this is how you should do it. We can do it together. Okay. Wherever you are sitting, just try to lift your heels. Okay. And hold it for 1 to 2 seconds and drop it back. We'll do it for 5 times so that you'll get an idea how to do it. So if you can't reach the floor, just come ahead in your chair and sit. Make sure you're comfortable and your feet is on the floor. Okay. And try to associate with your breath work. So while you lift, you should exhale. Lift, exhale, then just drop down your heels. Lift, exhale, drop down. Lift, exhale, drop down. Lift, exhale, drop down. Lift, exhale, then drop down. So this is the simplest technique that you can practice in your day-to-day life so that you can have significant result in managing blood sugar. Not only blood sugar, it will have a lot of impact on your inflammation in your body, help to lose weight in a better way, help to control various metabolic disease like hypertension, thyroid, and all these things. So it's the simplest technique that you can do it at your home and have significant result. And I'll tell you one shocking research which tells that 8 minutes of solius push-ups is equivalent to 500 mg of metformin tablet that people consume for diabetes initial medication. If you do it regularly for 8 minutes, that is equivalent to 500 mg of metformin. So that is the significance and importance of this simplest practice that you can do it at your home and make it as your routine. Okay. So what I'll suggest you is 8 minutes of solius push-ups 3 times in a day. Okay. Preferably 30 to 45 minutes post meal so that it will have impact on your blood sugar. So to start with, if you can't go with 8 minutes, at least start with 4 to 5 minutes. Do this calf rise wherever you're sitting. No need to go out. No need to look for fancy equipments as well. Just do it in your chair. And as I told, 8 minutes is significant and gives significant result. But to start with, you can have 4 to 5 minutes post meal. Don't push yourself too much. If you're getting pain, don't push after that extent. But make sure you will do it at least 4 to 5 minutes. 30 to 45 minutes post meal. Okay. So this is second thing. You can just take a screenshot of it or write it somewhere. The second practice you should practice and you must practice. So along with this, third thing is resistance and strength training. Most of us think that resistance and strength training is just for bodybuilding, only bodybuilders should do. But resistance training is very crucial to build that, to manage that insulin resistance. I'll tell you the reason, because most of these insulin receptors are present in your skeletal muscles. So once you activate your skeletal muscles, this insulin receptors will increase. That will activate that insulin receptors. And once you increase your muscle bulk, your insulin resistance will become better because of more receptors. So there are more insulin receptors in the cells to absorb that insulin which has been produced in your body. So I'm not telling you to start with fancy gyms if you are new to workout, because most of us, especially elderly people, have that resistance to go to gym and start working out. I'll just tell you, take that simple resistance band, you'll get it in Amazon. So just try to do strength training, concentrating on major muscle group 3 times a week. In upcoming days, we can also have this session. I can teach you what are the simplest technique you can practice with the help of resistance band, that you can do it at your home. Okay. If you don't even have resistance band, just take water bottles. Just take 2 liter water bottle and do some basic which concentrate on major muscle group. Okay. Mainly biceps, triceps for overhead shoulder rise, and also some from for some back. So these are the simplest thing. If you can just spend 15 to 20 minutes 3 times a week, that is more than enough to start with. Okay. So prioritize strength training, and it is very crucial for diabetes, insulin resistance, and most of your issues that you have in your day-to-day life. So uh, next we have toxic substances, alcohol, smoking, and other things. As we all know, these are very significant, and no amount of alcohol or smoking is good for good for our body. So avoid it. Mainly alcohol and smoking that have crucial, significant impact on your blood sugar level and your metabolism. So next factor is sleep. Uh, we have heard about significance of nutrition in diabetes and exercise in diabetes, but whatever we are speaking in upcoming slides is very crucial, and most of them will not address, and most of us are not aware this might be the cause for our diabetes or insulin resistance. So let's start with our sleep. Okay, because sleep is a time where our body recovers. If you are not sleeping well and not sleeping right, that will cause most of your disease and metabolic condition to set in and to start with. So you should be very careful about your sleep. Try to understand your sleep quality rather than knowing the duration of sleep. Sleep quality is also very important. How will you assess your sleep quality? You just ask yourself once you wake up, do I feel fresh once I wake up in the morning? Or do you feel you need more sleep? Okay. That is one of the parameter to assess the sleep quality. We also have advanced sleep tests to assess your sleep quality. If you want, we can also do those advanced interventions. But thumb rule is you should feel fresh once you wake up in the morning. If you are fresh, then you are like you're having that sound sleep. Okay. And you should also look for few more factors like snoring. Snoring is one of the significant thing that will have impact on your sleep and sleep quality. If people are snoring, we'll call it as obstructive sleep apnea. So that is blocking your airway. Okay. So if the person is snoring, that will hamper your sleep quality. So you should be aware if the person is snoring. Okay. So there are simpler practices that you can include in your day-to-day life. Okay. Uh, as I told, exercise is very crucial to do it on regular basis. Reducing stress with some simpler breathwork practices and meditation. Avoiding unhealthy snacks in the late night and late night dinner, and avoiding blue light. That is very crucial. Try to avoid blue light and dim the light after at least 1 hour before you go to bed. And other important thing is sunlight exposure within first hour once you wake up in the morning. It's not just how you can improve your sleep. It largely depend on how is your morning routine to improve your sleep quality in the night. Okay. So make sure you expose yourself to bright sunlight within first hour once you wake up in the morning. Try to go to nature try to take some walk in the nature with bright sunlight. That will help in production of melatonin, which is called as sleep hormone. That will help to enhance your sleep quality in the night. So sunlight exposure in the morning and avoiding blue light in the night, these are the very important steps to improve your sleep quality. Make sure you do this on regular basis and try to limit coffee or tea in the evenings. Okay, most of us have a habit to sip on our tea or coffee at 6 o'clock or 7 o'clock. That is important thing that is having impact on our sleep, because these are stimulants and half life of tea or coffee is like 6 to 7 hours. So once you have it, it will keep you awake for next 6 to 8 hours. So make sure you will not have your tea or coffee after 5 p.m. in the evening. Okay, these are very crucial and significant. And along with this, what I want to emphasize is having this practice consistent. Okay, having this practice regularly. Okay, because rather than doing practice once a week or twice a week, even though it's simple practice, try to add one thing to your routine and try to be consistent with that, because that is very crucial. Once you practice anything for 21 days, that will become your habit, but make sure you are regular with your practices. Okay, so next I want to bring in the simple concept. Okay, uh, that is called as sympathetic and parasympathetic system. We have two systems in our body. Sympathetic, which is called as fight and flight mechanism. Parasympathetic, which is called as rest and digest. So you can see Tom and Jerry. Sympathetic is overactivity when they are in that fight mode. So our body is in like state of overactivity. You can imagine what all symptoms the person experience. In other picture, you can see when snake is chasing a person, the what all things the person experience. Heart rate will be more, pupil will be dilated, and the muscles will be contracted. Okay, and during this fight and flight mechanism, only two things in our body is activated. Okay, one is your brain to think and musculoskeletal muscles to activate, but rest all the things will be compromised. Your liver function, kidney function, pancreatic function, your gut health, all these things are compromised when you stay in the state of sympathetic overactivity. In our current state, we are all of us in the state of sympathetic overactivity. Previously, during our evolution, it used to get activated only during certain situations, whenever the wild animal is chasing a person, whenever there is a war. But in our current scenarios, like every deadline is like a wild animal chasing. Our boss is like a tiger who is behind us all the time. So that causes sympathetic overactivity in most of us. We are in the state of sympathetic overactivity as if the dog, not even dog, as if the tiger is behind us most of the time. When you are in this state of sympathetic overactivity, most of the things that needs to be prioritized is compromised. Your kidney function, pancreas function, liver function, which is very crucial for your diabetes management, insulin resistance management, and most of your metabolic disease. So what you should do, try to stay in this parasympathetic state most of the time. I'm not asking you to go on vacation every day. It's not possible with our current state. Uh, but what we can do is we can train our body to stay in this relaxed state or parasympathetic state, even when you are practicing and doing our current work, current routine. Okay. So next we have few practices that we can do to help you in this to stay in this parasympathetic state or rest and digest phase. Okay. So are you clear with this fight and flight and parasympathetic response, how it have impact? Just type S or give thumbs up. Okay, good. Happy that all of you are following and try to make it as simple as possible. So as I told, it has a great impact. Chronic stress will increase something called as cortisol, which is stress hormone in your body, and that will have impact on your insulin resistance and blood sugar. Because when you are in that emergency state, body will ask for blood glucose. When the wild animal is chasing person, your body should produce the glucose to escape from that emergency. So what your body do in this emergency state is your body will produce glucose within your body. It's not that whatever you eat will increase your blood sugar. Our body has the capacity to produce sugar within yourself. Okay. So whenever you are in this fright and flight mechanism, high stressful state, the body will think that your body needs some support, and it will start producing glucose within your body, and that will cause increase in your blood sugar. Now, are you clear with your concept why stress will cause high blood sugar? Most of us think that, as I told before, it's just with your diet and physical activity or sedentariness that will have increase in blood sugar. But stress, your emotional health, is very crucial and significant thing that will have impact on your metabolism, physiological health, and mainly insulin resistance and blood sugar level. So you should be very careful, and you should be mindful about your stress and how you are managing it and how it is having impact on your body. Okay. So psychosomatic balance and daily healing tools. So unresolved stress causes increase in cortisol that will cause insulin resistance. Our mind and metabolism are deeply connected. Emotions can alter insulin sensitivity, and it can cause spike in your blood sugar level. And our emotional rigidity is a mirror for our metabolic rigidity. If you are having all these things, you should question how is my stress level? How am I managing my day-to-day activity? How anxious I am in our day-to-day life? These are the important parameters and questions you should ask yourself to see the results. Okay. Healing starts when we relax the body, not just by restricting the food or doing physical activity. So there are also research which tells that job strain is a risk for type 2 diabetes. That is done with 124 people with both men and women involved in it. So office stress and office strain is key factor that causes increase in blood sugar. I just want to tell you one real patient experience that I saw in my recent time. So I used to put CGM for my patients to assess their blood sugar level, and I asked them to track their meals. They will track their blood sugar, and I will see their readings with that continuous glucose monitoring patch, and they should mention what they eat throughout the day, so that I can correlate with their food and change the rise in the blood sugar level. For this particular patient who is a 28-year-old female who is working in sales, so I can see her spike every day in the evening around 5 or 5:30. But when I asked to probe her, what is the reason for it? I asked her, are you having any snacks? Are you consuming tea? Are you having something in the evening? She denied for all these factors. Okay. But when I tried to dig more deeper into it, I got to know that she is having stand-up meeting every day at 5:30. So that stand-up meeting is causing her spike in her blood sugar level 30 to 40 times. Okay. In 40 to 40 mg of blood sugar rise just because of that stress that she have with the stand-up meetings. Just imagine the impact of stress and anxiety that you have in your blood sugar level. This is not any theory which is like imaginary theory kind of. This is a science I have noticed with numbers, and there are significant studies which tells that importance and significance of your stress level and how it is having impact on your blood sugar level. So you can see in front of your eyes how these blood parameters and physiological and emotional health are directly interconnected with each other. So now we do simple breath work that I'll teach you to stay in this relaxed state. As I told, everyone will be in this fright and flight, and we can't escape from these situations in our day-to-day life. What we can do is how we can manage it in a better way. What are the simple techniques that we can help you to manage this in a better way? Okay. So it is slow and gradual inhalation through nose and exhalation through your mouth. It's called as pursed lip breathing. Okay. So we can do 5 sets of deep breathing, and I'll tell you when you should practice this on regular basis. So you can sit legs on the ground, palms on your thighs, palm facing upwards. Okay. Let's start with deep breathing. Slowly and gradually we'll inhale through nose for 5 counts and exhale through lips on 5 counts. Just try to focus on the area of your heart when you do deep breathing. We'll do few steps, few counts of deep breathing. Let's start with inhalation. Inhale, 2, 3, 4. Exhale through mouth, 2, 3, 4, 5, 6. Inhale through nose, 2, 3, 4. Exhale through mouth, 2, 3, 4, 5, 6. Once again, inhale through nose, 2, 3, 4. Exhale through mouth, 2, 3, 4, 5, 6. Once again, inhale through nose, 2, 3, 4. Exhale through mouth, 2, 3, 4, 5, 6. One last time. Inhale through nose, 2, 3, 4. Exhale through mouth, 2, 3, 4, 5, 6. So, and slowly and gradually open your eyes if you have closed your eyes. So, this is the simplest technique which you can practice on regular basis. Okay. You just type, yeah, I can see Hari, he is feeling calmer. You just see how you're feeling. You just type in a chat box. If you're feeling calm and relaxed, just type yes. So, one last pillar is connection and purpose in your life. Along with all these factors, man is a social animal. We need to have right people around us and right connection. That is very crucial to have this mind body, relax both your body and your mind. So try to have good community with right amount of people in your life, and try to have purpose. Having that purpose will help to have that fire in you, and that will help to prevent most of the disease which you have in your day-to-day life. So this is the last slide where you can see what are the things that you can practice on your day-to-day life. Just take this as screenshot or note it down somewhere. Start with heart coherence breathing. Okay. Inhale through nose for 4 counts and exhale through mouth for 6 counts. This you should do it on regular interval. Okay. It's not just doing once in the morning. So you should do once in the morning, once in mid-morning around 11:30, mid-afternoon around 2:30, once in the evening, and before you go to bed. So if you do it on regular basis, that will help you to keep in that relaxed phase, rest and digest phase throughout the day. So just make it a habit. I know it's difficult to start with. Okay. So for this, we are coming up with a tool called as NeuroTwin in upcoming days that will help you to keep you on track and suggest this basic breath work to help you to stay in this relaxed phase and rest and digest phase. Okay. So just practice these things and be regular with your solius push-ups, and having healthy plate and meal sequencing is very crucial. Just 3 things you include, you can see significant results. But you should also try to consider a practitioner to help you to guide you in the right way to do this blood test and interpret that and help you to give specific interventions. But these things you can start irrespective of in which state you are in. It doesn't have any side effects or impact on your body. It's good for people who are suffering with diabetes, want to prevent diabetes, having any of these symptoms, and to manage your life in a better way. So every action, every breath, and every step, and every mindful meal is a signal for your body to feel safe, nourished, and healing. So takeaways: diabetes is preventable and reversible. Remission of diabetes is possible by addressing this root cause. Focus on insulin health rather than sugar control. Small, consistent change lead to long-term metabolic resilience. So thank you so much for bearing me for last 1 hour. So if you have any questions, you can just drop in, or you can just unmute and tell about the sessions and how you feel. And if you have any questions, you can just interact. Yes, Anuksha, I'm done.
Mm.
Yeah. Hi, Dr. Anurag.
Hi, Hari.
Yeah, thank you. Thanks a lot. I learned a lot in this session, a lot of new
Mhm.
things.
Okay.
Actually, I do think I have insulin resistance. Like I have black patches on my neck,
Mhm.
arm, and all.
Mhm.
Then I do have a lot of visceral fat,
Mhm.
which I'm not sure how well I was trying to lose it, but
Mhm.
it is not going away. So I just want to know like how much time I have before diabetes hits, what all I can do. Of course, I'll join a gym, start
Okay.
eating more well.
Got it. So as I told you, get this blood test done. Try to know your fasting insulin and blood sugar level. By that we can know the stage you are in. Okay. Whether you are in early stage, whether they are in mid stage, whether you are in advanced stage. Okay. So based on that, we can decide in which state you are in and watch uh, how to start with. But irrespective of which stage you are in, you should start with these practices. You should start with your interventions. Uh, just by your symptoms, I can tell that definitely you are in state of insulin resistance. So rather than looking into that stage, just start with the practice. But it's good to know these numbers so that you are more cautious and you know about your deadlines and how regular with your practice and be consistent with those things.
Yeah, sure.
So
Thank you.
just try to do this and try to get those blood investigations, whichever I mentioned, and that will help you to manage things.
Sure, sure.
Okay, thank you. Any other questions?
There is a question by Triveni, Dr. Anurag.
Mhm.
I'm just going to read it out for her. So, though I practice diet and physical exercise, my blood sugar levels vary. What could be the reason? I think she's asking that.
Yeah, as I told, how consistent they are with their diet and their practices is very crucial. It's not like practicing for 3 days and not practicing for 5 days. So being regular, at least 75, 80 or 85% of their time, they should be consistent. If they're consistent 85% of time, there is some option to cheat for 15%. But 85% at least, uh, 6 days in a week, you should be regular. You have an option to cheat once a week, but rest 6 days, rest of the times, you should be very regular. And along with that, as I mentioned, stress and emotional health and sleep plays very crucial role in our practice. So even though if you are there regular with your diet, if you are not, if you're stressed and if your sleep is not right, that will definitely have impact on our blood sugar level. So try to be regular with these practices, breath work, meditation, relaxation techniques, and try to keep your body in that rest and digest phase so that you manage your blood sugar in better way. So yeah, yeah, Akshita.
So my mom is pre-diabetic and
Mhm,
she has been suggested breath work, exercises, food, and everything. She would do it
mhm,
for a week, but then it's
mhm.
very difficult for her to be consistent. Like
Yeah.
you can do something for one day, but it becomes a task. वही चीज रोज रोज करना. So that's what
Mhm,
I'm asking. How do we bring this habit? How do we build this habit of, doing breath work 2 or 3 times a day? She's like, मेरा तो इतना घर का काम है. I get tired, and then
yeah.
adding these tasks is something like वो habit नहीं बन पा रही.
Yeah. So there are two solutions for it. Be with the community, be with the people who practice it regularly. Take a
Huh.
support of a coach who help you to keep you on track, because if you are accountable to someone, you'll be regular and consistent. So you can connect with Anuksha. She might help you with coaching and how to be regular, and she can provide with the practitioner, can help you to be regular with and consistent with the practice. And second thing, as I told you, we are coming up with a digital platform, digital app that will help you to notify you on regular basis and simpler breath work. That will also tell you your response and how your body is responding to it. So we'll also come up with a solution soon that can be utilized. Before that, try to stay with the people. Let's form a group and practice things together so that we'll be in track. Okay. So Anuksha can give better solution for it, how we can have that community and people who are practicing it on regular basis.
Thank you. Thank you. Do we have any more questions just before we go into that?
Yeah, I had one more question.
Yes.
So this
Yes,
is
please.
just out of curiosity, like it is not related to me. So I saw one video where one girl is very lean, very thin, but
Mhm.
still she says she is diabetic.
Yeah.
So what might be the reason behind that?
So as I told, first reason can be high visceral fat, tummy fat. So most of our Indians are like thin outside and fat inside. Even though we look clean, that fat in your tummy, visceral fat is reason. Because once you have that visceral fat, that will accumulate in your liver, pancreas, and hamper their function. Okay. So that is one of the main thing. And type of diabetes also we should get to know, because I'm just speaking about type 2 diabetes, which you will get with metabolic conditions and these things. There are different types of diabetes. Type 1 diabetes, where the production of insulin is hampered. So body will not produce right amount of insulin because body don't have capacity to produce that insulin. And there is also type 1.5 diabetes, which is autoimmune condition, where this receptors which has this insulin, which accept this insulin, will not working right because of some autoimmune conditions. So we should identify what is the type of diabetes the person is having. If it is type 2 diabetes, as I told, visceral fat is the issue.
Okay, thank you, sir.
Thank you.
There's one more question, doctor. I think that could be the last one. Is that so? Amulya asked is as the strength training helps, is there any alternative or how to make it possible for elderly with body pain and other physical hindrance?
So we should identify the reason for the pain, and I should consider managing that pain in better way, because if people are having pain, it's difficult to have strength training. So try to address the root cause and manage the pain in better way initially. Once we and increase in blood sugar might also be the reason for chronic pain. So it's a vicious cycle. So once we manage the pain with some medications and right diet and right supplement, simultaneously start small, start with basic workout that will help to strengthen the joint first, and gradually increase the intensity of the strength training.
And one more thing I wanted to ask, is it possible to get this PowerPoint, because I feel it is very helpful?
Yes, Hari. Yeah, yeah,
I
please
can
go ahead.
make it a Google document and share this information.
Sure, sure. Thank you.
People in the community will get this information.
Also, Hari, just for everybody's information here, that this session is recorded, so we will be putting it up on the website, and we'll share the link in the community, and also individually we'll reach out to everybody, so that they have access to the video, as well as if anybody wants to book an appointment or any sort of have any conversation with Dr. Anurag further, we can also assist that process. Yeah, and thank you for sharing the importance of community and habit building, because we've seen, as much as we work together in my practice as a psychotherapist and a psychologist, I've seen that any sort of habit building takes time. You need the community support. There needs to be an accountability structure in place where somebody from the community can reach out to you, a health coach can support you. So we want to make sure that we don't just share, like I think, share solutions, but all of us work together as a unit. So the doctor is present, the health coach is present, I would be present, and we go towards a process of recovery together. So so we will obviously, I will, whoever's interested can join the community, and also will individually reach out to you through emails and through the phone numbers. But if you don't want any communication, you can always tell us and we'll stop. So yeah, thank you.
Yeah. One
Yes.
last thing, just put your 3 takeaways from the session in the group, so that the people who are not joined, even though it is free session and Sunday morning, where most of them, they should be aware and they can know what is the importance of it. So whoever in the group, whoever in the community, just post your 3 takeaways and let them understand, so that we are planning to conduct more sessions in upcoming days. so that they can utilize and make use of it and they can part of the system.
Please, please, that's very important. Even now, if you want to unmute yourself and tell any three takeaways, any three highlights, we'd be happy to hear. We have another 2 minutes probably before we close.
Yeah, can I share some? So one was the solius push-up. I had no idea like I could do that and help with my health management. So that was one, and another was the breathing technique. So these two are like very important takeaways for me, which I feel will help me in the future.
Thank you, Ravi. Thank you, Hari. Sorry, I was just replying to Ravi. All right. Thank you
Okay,
so
then.
much.
Thank you so much for all the active participation.
I know.
People were active and they were responding to chat, and even the smaller group, I think whoever attended has got maximum benefit and they utilized it in a right way. So,
Absolutely. It was indeed very enlightening, and I think so many aspects were covered, which are known, but to see it together, hear it from an expert is another thing altogether. So, really, thank you so much, Dr. Anurag, and I'm really happy and excited that more such webinars are coming up. And yeah, looking forward to all of them as well in the
so
future.
thank you all.
Thank you. Bye.